Hey folks, this is Ignacio, President of North Star Senior Advisors, so welcome to another episode of Next Chapter in Aging. Now what? I have my co-host here, Jessica Branning.
Yep, I'm Jessica Branning, and I am the CEO and founder of ClinCloud Clinical Trials.
So again, thank you for joining us today. And today's topic, very important topic. So we're talking about understanding dementia. And I know some people have a pretty good grasp on dementia. Mm-hmm. There's a lot of gray, there's a lot of confusion, misconceptions. So I think this is a really good opportunity for us to come in, for you to come in here and really explain a little bit more in depth. So let's kick it off with the first question, which is a common question. I hear this a lot too. What is the difference between dementia and Alzheimer's?
I mean, it's a wonderful question. I hear it all the time, day in and day out. And the big thing is we think of dementia almost like an umbrella term, okay? Right. So dementia simply means memory loss. And then what causes it is what then creates different types of dementia. Alzheimer's disease being one type of dementia. Then you have Parkinson's, that can also be a type of dementia too. Vascular dementia, stroke is a type of dementia. But the most common, as I indicated, is Alzheimer's disease. And that's where a lot of attention in the research world, in the clinical world, has been focused because with our growing and aging population, it's becoming more and more prevalent. Okay,
got it. So dementia is the umbrella, and there's multiple forms of dementia. Yeah. So if we're talking about Alzheimer's specifically, who is at risk for Alzheimer's?
So individuals who are at risk, I always put it in a few different categories. Number one is there's genetic risk factors. So you can have a gene known as the APOE gene, and if you have a copy or if you're a carrier of the APOE4 gene, that puts you at a higher risk for developing Alzheimer's disease. So maybe mom and dad were having memory loss, even as short as 50 years ago, Alzheimer's disease was getting misdiagnosed left and right as, a mental health issue or someone's just aging and just part of that nature. So I always pair the genetic component to look at your family history too. Because if mom and dad were also having memory problems and you weren't sure if it was Alzheimer's disease or not, just be mindful of that because that could still put you at risk too. Other risk factors are heart disease, so cardiovascular problems. So if you have hypertension, high cholesterol, that can put you at risk for Alzheimer's disease. Diabetes is, I feel like one of the most terrible conditions that our world is facing, but it also is a component that can put you at risk for Alzheimer's disease. They actually have stated that Alzheimer's disease is the type 3 diabetes.
Wow.
Just because of all of the metabolic issues that are arising from that. It's just creating a lot of inflammation. And the brain doesn't like that. The body doesn't like that. Other risk factors are social and or environmental. So say, for instance, when you were younger, you were a football player or you played a lot of sports, a lot of contact sports, and you had multiple concussions when you were younger. That could put you at an increased risk. Or
traumas.
Trauma, trauma to the head. That can put you at risk. And there's other factors that we are also starting to learn now, such as Agent Orange and lead paint. They've also linked to potentially cases of Alzheimer's disease as well, just because those toxins and breathing those in can put you at an increased risk. So it's a lot of different risk factors that could lead into Alzheimer's disease, with the number one risk factor, aging.
Aging, yeah, of course. Yeah, it doesn't help as we age.
No, yeah. And people are living longer.
Yeah.
Too. So I mean, again, if we look at how history is, 100 years ago, our life expectancy was nowhere near what it is today. So it is an aging disease as well.
Okay, got it. So, as we talk about the potential risk factors. Symptoms, that's the other thing, right? So if somebody's caring for somebody, let's say a spouse or son or daughter starting seeing changes in mom or dad, what are some symptoms specifically to Alzheimer's that they may be red flags and they're like, okay, time to go to the doc, time to go to a neurologist or maybe ClinCloud?
So the number one, and I always say this first, is because I feel like it's a common symptom that people just kind of push off to the side, and it's when you're driving and you have a sense of confusion, or maybe mom or dad are going to the Publix down the street that they've always gone to, and they miss the turn, and we brush it off as, oh, mom, you missed the turn, you got to turn around, go back. That, when you're starting to notice some changes from a direction standpoint, especially going to places that you've frequent and you've gone to time and time again, that's a big red flag that something might be going on. Then you've got your traditional, as I age and people say, oh, I put my keys, in the room, and then I go in and, I couldn't find them again, or, the biggest thing is it's the frequency of those occurrences. So if it's starting to become an every day, every other day occurrence where I'm repeating myself, or I am going into a room and I don't know why I went in there again, or starting to misplace items in odd locations. So say I have the TV remote and I put it in the refrigerator. Why did you put it in the refrigerator, right? So it's these little things that we start to kind of laugh off and just say, hey, it's part of natural aging. Is it though?
Yeah.
Right? So that's the big thing.
Gotcha.
Is it though?
Okay, got it. Makes sense. Because as we know, dementia, Alzheimer's, it's a progressive disease, right? So it's not something that you get, you plateau, and it's like, okay, I have it and I'm okay, but nothing else will happen. We know that it is progressive, correct?
Yeah, exactly.
It will, unfortunately, continue to get worse. Okay. So we understand the symptoms now. So how do we get evaluated? So here we are. We know the risk factors. We know potential symptoms. We mentioned a few just now. There's concern. Now, what do I do? What are my next steps? How do I get my loved one evaluated for this potential disease?
My biggest advice is that, especially once you turn around the age of 50, advocate for yourself to get a memory test done, whether you're having memory concerns or not, because early detection is key, right? So, and it might very well be that we do a memory assessment and we see that there's nothing wrong. But with some of the research that we're starting to do, we're learning that we can detect before symptoms actually even present themselves. So that's part of the reason why I say advocate for yourself, because once you turn 50, you should be able to get a memory assessment from your primary care doctor through your annual physical that you get done. You can also come to places like ClinCloud, where we offer free memory assessments every day so that you can promote your brain health. If you're starting to notice changes, again, the first step is going to be getting that memory assessment, because we've got to get a baseline of where you're at, whether you're getting that through your doctor, whether you're getting that through a clinical research facility. Sometimes people tend to lean a little bit more towards the clinical research facility because they view it as, I'm not going through my insurance, I don't have to pay for it, and I'm just curious because I've started to notice some changes. And if I were, a caregiver, for somebody who I've started to notice changes, so maybe my mom is starting to notice changes, my biggest thing is you're advocating for your brain health, just like you advocate for your heart health, just like you advocate, if you're female, for making sure you don't have breast cancer, right? You go and you get your annual mammograms done. We've got to start normalizing taking care of our brain and going and getting these brain assessments so that we can be proactive about our brain health.
Okay, got it. So, folks go in, let's say they see the physician or neurologist and they get evaluated, they get testing done, or if they do have limited resources, they can go to ClinCloud and get this for free. Question would be, okay, so I'm diagnosed. What medicine can I take for Alzheimer's? Is there a medication for Alzheimer's?
Yeah. So I wouldn't say that there's a medication, a great medication for Alzheimer's disease right now. There are medications that are FDA approved right now, known as donepezil or Aricept, memantine, Namenda, and then there's the Exelon patch. And they really are helping to target the symptoms of memory loss, right? They're not targeting the root cause of Alzheimer's disease. And that's where in the research world, we are still looking at medications that are trying to target the root cause of the disease itself.
Okay.
Yeah.
So, okay, that's interesting. So let me ask you this. So is the goal through research or future medications to halt the progression from where you find it, or is it to reverse?
Right now, a lot of the focus is more on slowing down the progression of the disease so that we're not getting to a point where, we're not remembering our family members or we're forgetting how to feed ourselves or, really trying to help preserve the quality of life. Although they're pushing research sooner and sooner and sooner so that those that aren't experiencing memory loss at this point in time, but they have the risk factors or the biomarkers, I should say, for Alzheimer's disease, we're trying to intervene sooner so that the symptoms of memory loss perhaps never occur.
And it's interesting because, we have some experience with some of the clients that we work with, and we're in the space a little bit, probably not as much as you folks, but it's interesting to see how there's so many stages to this, and the progression upon those stages vary by the individual and different dynamics. There's no two that are alike, it seems like, in terms of timeline to progression. Some individuals might be early stage for X amount of months, maybe a year, and by the time they progress to a very late stage, is more significant than others. So that's very interesting to me how there's really no gauge, right, in terms of knowing how this will accelerate for an individual. So going through the testing and getting the information as soon as they can is important.
Yeah. It really is. Just kind of going off of that a little bit too is typically if you are younger and you're starting to notice memory changes, so say you're in your early 40s and you're starting to notice some changes with your memory and you have some risk factors, maybe you had a family history, start talking sooner to your doctor about getting a memory test done or getting checked out to see if you are genetically at risk for Alzheimer's disease, because the younger you are, the progression of the disease will tend to be a little bit quicker than if you were to get diagnosed in your, say your 70s. It's not as quick of a disease progression.
Okay. I'm going to go ahead and ask this because I haven't asked it. So, is there a cure for Alzheimer's?
Right now, no. There's not a cure, but there are some amazing treatments that are on the horizon that we're all incredibly excited about. I can go into detail about some of those.
I know some of that's through research, right? So if you don't mind, explain some of that.
Yeah, of course. So the primary medications that we have looked at and that are kind of going through the FDA approval process right now are a drug class known as monoclonal antibodies, okay? And this drug class has been tested on other conditions to help, treat cancer, Parkinson's disease, migraine, osteoarthritis. But what they've done is they've modified it so that it's targeting certain proteins that are associated with Alzheimer's disease. Those are the amyloid protein and the tau protein. The amyloid protein creates plaques in the brain. So I always equate it to a big giant traffic jam. So your memory can't get across to the other neuron, which are your communicators within your brain, in order to recall a memory. And then you have the tau proteins, which create tangles, which I always equate to your Christmas lights. There's a tangled mess. You can't get around it. And what these medications are trying to do is target those proteins to remove them and stop them from accumulating as much, so that we're targeting the cause of the disease and then trying to slow down the progression in itself.
Okay.
Then there are other medications that we're looking at too that are not necessarily being used to slow down progression, but trying to help modulate the treatment of the disease. So if you're a little bit in the later stages of the disease, these are small molecules that are trying to target inflammation responses, so trying to reduce that inflammatory response to slow down those amyloid plaques from developing and the tau tangles from developing.
Okay, got it. This just came to mind. So if if I'm a physician, either a primary care or neurologist, and I'm comparing myself to like a ClinicalCloud research company, do I have access? Do I have the ability to formulate a treatment plan for my patient based on experimental or research-based stuff, or is that something that ClinicalCloud can do exclusively? You know what I'm saying? Like, again, if I'm a primary care, can I expose you through treatment myself on something that's cutting edge or something new, or do I need to refer to ClinicalCloud for that?
So typically speaking, your primary care doctors aren't conducting clinical trials.
Okay.
You have some that are advanced and they're doing clinical trials alongside, but in all reality, when you go in to see your primary care doctor, they have a list of 15, 20 things that they have to go through. So what we're really trying to do is, again, working kind of collaboration with your primary care doctor so that they know that when you come to ClinicalCloud, we're doing what's called like a trial match. So we do a memory assessment with you, we review medical history, medications, your risk profile, and then from that information, that's how we match you to a potential clinical trial, and then make sure that your doctor knows, hey, this is the outcome. They've matched to this clinical trial, and we're looking at this medication. And there are some, and I think we talk in another podcast about this, that have no placebo arm, which basically is that's not the real medication. And we're seeing those come a little bit more and more frequent these days in the Alzheimer's disease space, because we're seeing a lot of advancements in the research world.
Makes sense. So if I'm a family member or spouse and I'm working with my primary care, my neurologist, and I feel maybe I'm not getting enough traction in treatment, can I request to my physician, hey, I've heard of a research company, can you refer me? Can I go to them directly? So for those that are listening and they want a more of an aggressive approach, more hands-on, they can do that, right? Reach out to you directly?
They can absolutely reach out directly. You don't need a referral to come to ClinicalCloud. You can give us a call, and we typically get you in within about 48 to 72 hours for that first initial brain assessment.
Okay, excellent. So last question I have here. So what are some tips for brain health? What can I do to make sure that I'm in top shape upstairs? Upstairs,
I like it. Number one is being proactive about your brain health. So starting now, if you're younger and you know you're at risk, in particular, eating a healthy diet. I always like to refer people to what's called the MIND diet. It's very similar to like a Mediterranean-based diet. So fruits, veggies, fish. Fish oil is really good for the brain. Physical activity, getting blood flow to the brain. The brain loves oxygen. It's like candy. So it loves it. Being social. Networking, talking, not trying to kind of shell up, because that's very common in individuals that start to notice changes. They kind of want to stay away because they become embarrassed if they become forgetful. Right. Don't do that. Keep talking, keep engaging. It's important to stay socially active. It's also really important to stay mentally active too. So, doing a puzzle, doing word searches, Sudoku. Everybody loves Sudoku. I always tell everybody, pick up a task that you maybe have never done before. So if you never really liked cooking, try starting to cook now, because you're creating new connections within your brain. And
challenging the brain.
Exactly.
Makes sense.
That's really, really important to do. Get a good night's sleep.
Yeah.
So many people that come in, to be quite honest with you, they're stressed out, they're not sleeping well, and that's really the cause of some of the initial memory concerns that they're suffering from. So you might even learn that, maybe it's just I need to change this aspect of my life in order to get my brain health and my memory back to normal, right? Going to your doctor regularly, right? Because you want to make sure you're reducing those risk factors. You want to make sure that if you have hypertension, that it's controlled. You want to make sure if you have high cholesterol, that it's controlled. Same with your diabetes. We can even check out things like vitamin B12. That can be low, right? And if it's low, it can affect cognitive function as well. So sticking with your doctors, going there regularly, trying to reduce your risk factors as much as possible is super, super important.
Okay, excellent tips. Good. So for those that are watching and listening, what's the best way to get a hold of you guys at ClinCloud and look into more information, maybe a consult, and participating through some research?
The best place to go is definitely our website, www.clincloudresearch.com. We've got a lot of great information on there from some of our physicians as well, Dr. Laird and Dr. Oliveira. They have some great videos on the website just talking about our resources. And you can always give us a call, too. Our phone number is 407-636-4031. And as I mentioned earlier in the podcast, that first initial consult, we can usually get you in within about 48 to 72 hours with one of our memory specialists.
Good. That's a quick turnaround.
Yeah, we try.
Yeah,
we try.
Good. Well, thank you, Jessica. Folks, I hope you found this beneficial. Understanding dementia was the topic today. I think, if anything, you'll walk away with some really good information and a great resource here as well. So thank you for joining us today.
Thank you.